So we just wanted to share with you some observations and a breakthrough that we've seen with a Lyme patient that we've been involved with for a long time, not particularly for Lyme. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner here at Power Health with Dr. Randall Gates.
I'm a board-certified chiropractic neurologist.
Together we work with the brain, the nervous system, and all the metabolic issues involved with chronic disease and chronic pain in our practice. We treat a lot of different things. Lyme hasn't been one of the things that we have treated per se. But we have, and I'm also a chiropractor. We're both chiropractors with these postgraduate degrees and certifications and diplomates and so on and so forth. And so our practice is my practice is probably 95% functional medicine, and Dr. Gates is probably 99.9% functional neurology. And together we treat a lot of different chronic pain and chronic diseases. And so we just wanted to share something with you that we saw. One of the things I can say is that in my education and my experience in the chronic pain world, one of the things I felt kind of a blank spot in, kind of a little dark hole in, was my understanding of Lyme disease. Didn't treat it really, obliquely, kind of heard this is what you do, and you do the antibiotics, and then you got this one treatment called shake and bake treatment where you're cold, you're hot, and all these different types of things. And I read all that, but I was pretty confused on it. And then read another book by Dr. Horowitz. I think it's called Why Can't I Get Well? Something very close to that, and it's called The Solution, I think, to Chronic Disease and
Lyme disease
and Chronic Disease. Yeah. It was interesting to read. I thought the first third of the book was as illuminating to me as anything on the medical model for Lyme disease and the antibiotics and the barriers and all of the different things that you can run into as to why that may not work. And then at the end of that, he basically says, and if you've done all this and it doesn't work, here's why.
Right.
Want to talk about the why?
Which is a lot of our program. We actually wrote a letter to Dr. Horowitz because we're extremely appreciative of the fantastic book he put out. There are a lot of books out there. Yeah. We're writing a book, and when I was, Dr. Rutherford I'm writing it, when I originally wrote it, it was a piece of crap. We were just trying to produce something.
And he told me politely had to tell him that.
And he told me that, and I'm really appreciative that he did. And we've read other, because I was just trying to get something out there quick. And we've read other books that are just very much the same. And Dr. Horowitz, it took him 4 years to write this book.
Yeah.
And he did a fantastic job, and he talks all about his experiences, the challenges an alternative medicine practitioner faces. And he talks all about the medical approach to treating Lyme disease, which a lot of people are doing out there now. But then he talks about all the other things that need to be addressed to help someone with Lyme disease, and that's a lot of what we do. And so we expressed our appreciation, our sincere appreciation to Dr. Horowitz. And in the book, he talks about how you have to address the immune system, you have to address the person for their toxins, you have to look at their mitochondria, which allow them to make energy, you have to look at their gastrointestinal tract, you have to look at their hormones, because all these things can be off.
For all the other chronic pain stuff that we have been treating forever.
Exactly. So we have a patient right now who's been through antibiotic therapy for years.
We've been through every Lyme therapy there. This young man, I'm in practice almost 35 years. I think I've known him for 31. And he's been going through Lyme for 20 at least. And he has to use a little motor scooter to get around. He runs a kind of a
auto body shop.
Thank you. He fixes the bodies of cars and has to get around. There are days he can't walk. I mean, I've been watching this decline for like 20 years. Very frustrated. Wanting him to maybe give us a try or something like that. But we're kind of friends when you've known somebody for that long. You don't want to cross that barrier. And his significant other is who brought me the book. Mm-hmm. And then I realized why they came to us, because she recognized that we were doing all the other stuff.
Right.
Now he is still doing yet another protocol for Lyme, mm-hmm. which is
they're doing basically irradiating his blood with UV light and a variety of things.
Okay, but in the meantime, they came here, and now we're putting them through our chronic disease and chronic pain program. And in the last 4 to 6 weeks, he's feeling, he by his own admission, or whatever you want to call it, testimony, he's feeling better than ever. And there is still a little bit of like, is it just doing this, or is it doing this with the newer procedure? But I mean, he's done it all. He's done everything you could possibly imagine that most of you have probably done if you have Lyme disease, from the antibiotics to the heat and the cold, and now he's doing this. But it's made us think that we have affiliations with the medical community that can duplicate those types of treatments if that's necessary. In that book, he talks about chelation therapies, which he talks about, which we don't do, but we have doctors that we work with that can do that. And he goes through all the antibiotics and how that's fraught with landmines because of all the different organisms and each different bacteria and so on and so forth. In the end, I'm not sure that if it's solely what we're doing, but for those of you who are where this patient was, a combination of what is being done in the Lyme clinics and a combination of what we do. And it's kind of a hairy thing. Our goal is not to promote for specific patients. We're just trying to
talk about what we've observed.
We're just trying to bring out what we observe, and this has been a big challenge for us. We've seen other Lyme's patients. They've done well, but we really didn't know why. I think we're pretty close to knowing why here, what went on, because we're so intimately involved with this patient over such a long period of time. And I think what we're just trying to bring to the patients, people here, are an integrated approach that can be fairly complex, but can be very successful. Now, our integrated approach, I will just tell you this, just so you can look at, if you wanted to kind of get an idea what we're talking about as an integrated approach. We've had a lot of stuff online. Maybe they would go to Power Talk.
Yeah, go to powerhealthtalk.com. All of our videos
look up
our autoimmune disorders, gastrointestinal problems, mitochondrial issues, chronic fatigue. I mean,
and neuroplasticity.
Neuroplasticity, not a bad idea either.
I would probably look at those two that we have patients look at before they come in. And I'm not saying to come in. I'm just telling you that if you look at those two, probably have a pretty good idea of what types of things that Dr.
Horowitz.
I would want to call it Abramson for some reason. That Dr. Horowitz wrote about in the other 2/3 of his book. He essentially said, here's a medical procedure. If you don't get to the person in 10 days, you're pretty much not going to get it done. If you do the antibiotic therapy and you feel good and they withdraw the antibiotic therapy, you're pretty much screwed unless you do all of this. And all of this is at least 2/3 of his book. So, and you can get his book. You can get his book. Probably would be a better, easier solution. Or you can get his book, or you can look at our website, or you can look at both to maybe give you some hope and maybe give you some sort of an idea of that you can actually get there from here and feel probably substantially better. I mean, this has been pretty profound for us. So we're just sharing with you. It's one case, but it's a case we're very familiar with. It's been an amazing turnaround, and this is not an easy patient. And I can say that because even if he watches this, he knows he's not an easy patient, and he looks like a whole different human being. And it's only maybe 6 weeks into the whole protocol. So just want to share that with you.
Absolutely. And if you have any other questions, go to powerhealthtalk.com, like we talked about. Go to our Facebook page, Power Health, and we appreciate you watching. Thank you very much.
Yeah.